a cofactor for many enzymatic reaction for many enzymes that metabolize carbs, lipids, and amino acids. So this is very important trace mineral. Okay, the classes of enzymes that have manganese cofactors include oxidoreductase, transferase, hydrolase, lysosomerase, ligase, lactase. So almost all enzyme, needs manganese. Manganese-dependent superoxide dismutase, MnSOD, Mn-SOD, manganese salt. Manganese-dependent superoxide dismutase. This is super enzyme that responsible to for for to what we call it to for the responsible for removal of the superoxide in our body. So this Mn salt binds to the superoxide byproduct of superoxide, which is the byproduct of oxidative phosphorylation. I asked you last week what type of metabolism that produce reactive oxygen species in the body. So it is oxidative phosphorylation. So this Mn salt binds to the superoxide, which is the byproduct from this oxidative phosphorylation, and then this enzyme Mn salt converts them to hydrogen peroxide and diatomic oxygen, the less toxic forms of the byproduct. So the deficiency for manganese, it is rare, but that's the toxicity for this manganese and affects the nervous system. Variety of psychiatric and motor disturbance, term manganism, affecting liver function. Food that contains high amount of manganese, such as nuts, whole grain, leafy vegetable. Most of the food that contain manganese is from from vegetable and from nuts, not from animal product. Okay, fluoride. Fluoride, importance of fluoride is identified as an element present in dental hard tissues, in the teeth, necessary to prevent dental cavities and to promote healthy bone growth. It's similar with calcium, make bones stronger, teeth more resistant to tooth decay. So sources: dietary, fish, tea also contains fluoride. 9, dietary, toothpaste, mouth rinse. So that's why your toothpaste contains fluoride, because it's important for your teeth as well as your bone. Toxicity for fluoride, we call it fluorosis. Too much can damage if you take too much fluoride, can damage your teeth. This is what's going to happen. Fluorosis caused by overexposure to fluoride during the first 8 years of life. So for kids, that's why the kids have their designated toothpaste. You cannot give the kids, infant, the toddler, the children, adult toothpaste like we use every day, because the amount of fluoride is quite high for them. For adult, it's fine. Okay, so the exposure of fluoride during first 8 years of life, this is the time when most permanent teeth being formed. Kids need to use kids toothpaste, not using adult toothpaste. Deficiency can cause incidence of dental caries. Dental caries is infection, bacterial origin, that causes demineralization and destruction of hard tissue of the teeth. So if you don't get enough fluoride, it also cause problem. The bacteria can easily infect your teeth, structure, hence cause demineralization. Because of this, bacteria grows in your teeth and in destruction of the hard tissue, so causing dental caries. And then chromium, essential nutrient involved in carbs and lipid metabolism. Again, there's so many trace mineral involved in carbs and lipid metabolism. maintaining glucose homeostasis, regulate glucose absorption by cells, and blood glucose and diabetes control play a role in insulin pathway, but not clear yet. So it has been said that some research shows that this chromium play a role in insulin pathway, but other researchers shows that there's no there's no significant difference when they put chromium and without chromium in the way that insulin pathway uh, activated. So this is still not clear, but this is how it looks like. Insulin. This is what they suggest in some of the reported data. This is what has been suggested. So insulin, we know that we have insulin receptor in some of our cell. When insulin comes, bind to the insulin receptor. This is all transduction pathway, right? So insulin binds to the receptor, and then the activated insulin receptor will, in return, activate the chromium channel. This chromium channel, when activated, will open and allow the absorption of will allow the movement of chromium from extracellular to intracellular. When lots of chromium migrate to intracellular, will produce aprochromatodulin complex with chromium, and then this aprochromatodulin will bind to this insulin receptor to bind to more insulin. Okay, but this is only a couple of paper, but it's still not clear. Some said that's no effect. Some said there's effect of chromium in insulin pathway. Because when you do research in the lab, it's not like straightforward. When, for example, I do my research, I found that this can activate this, but if maybe you do your research in your own lab, maybe your lab in another country, and when you repeat my research, you cannot get it, and then you say that, okay, this A cannot activate B, but I say this A can activate B. You done you repeat my experiment, you said A cannot activate B, and another people in another country try to repeat it actually A activates C. But even you are using the same type of methodology, the same type of uh, consumable, you can generate different type of results, right? This is not new. This is what happened in the research world. And then the deficiency of chromium creates diabetic-like symptom. For those who have deficiency of chromium, you will show that diabetic-like symptom, even if you don't have diabetic. All right. So short-term deficiency of chromium will give will create diabetic-like symptom for that individual. So when you get your chromium daily recommendation chromium fix, you will remove this symptom again. Source of chromium can includes broccoli, grape juice, especially red grape, meat, whole grains products. So normally it's from plant products, not animal product. Next, molybdenum. Molybdenum is a factor for many enzyme in protein metabolism. You know that chromium enzyme in glucose metabolism, lipid metabolism, molybdenum for protein metabolism. For example, xanthine oxidase is a molybdenum-containing enzyme. This xanthine oxidase contains molybdenum in its structure. So the oxidation of xanthine to uric acid, a process of purine catabolism. So without molybdenum, we cannot have this enzyme function properly. So we cannot process purine. We cannot catabolize purine. Molybdenum level also affect protein synthesis, metabolism, and growth. Inability to synthesize molybdenum cofactor will result in high level of sulfite and urate, and this is neurological damage. Okay, again, what's the main function of molybdenum? Molybdenum is a cofactor for enzyme in protein metabolism. For example, for enzyme xanthine oxidase. So if you have deficiency in molybdenum, for individual that have deficiency in molybdenum, so you will have a problem in this enzyme here. Okay. So what this enzyme does, oxidation of xanthine to uric acid. So you know that a process of purine catabolism. If you have high amount of uric acid, you know, you can have, it can develop neurological damage. So that's why we need molybdenum. Source for molybdenum in legumes, cereal, and nuts. Again, this is similar to chromium. Molybdenum can be found in plant-based diet. All right, now we go to we done with the essential nutrient, mineral and macro mineral, trace mineral for our diet. That's really important for our body. That's responsible for many biological function in our body, cofactor for many type of enzyme in protein metabolism. Some responsible for carbohydrate metabolism, lipid metabolism, and now we will discuss about the minerals that we don't want in our body. We call it contaminants mineral. There are a couple of contaminants minerals, but the main, the most contaminant mineral that give us a very high toxic effect are like lead, mercury, and cadmium. So these contaminant mineral can enter our body through food and water, okay, as well as soil from vegetable, for example. These contaminant mineral, these dangerous contaminant minerals will interfere with our nutrient intake, and the bioaccumulation of these contaminant minerals leads to kidney and liver damage. All right, now we will see the nutrient and micronutrient in pregnancy. What nutrient, what micronutrient, that's very, very important. That's extremely important, vital for pregnancy women. Most of this we already discussed, but we're just going to focus why this is important for pregnancy, during pregnancy and lactation, some of them. So what are the important micronutrients during pregnancy? So we have about 6 that extremely important. For example, vitamin A, folate. Folate is vitamin B. Can you recall what type of vitamin B is this? So iron. Iron is trace mineral. Iodine, trace mineral. Calcium is macro mineral. Zinc, trace mineral. So vitamin A, benefits for vitamins A for those pregnancy women, or for lactating women. It helps in postpartum tissue repair. So vitamin A helps in tissue repair during postpartum. Indication for vitamin A supplementation: improve visual health, immune function, fetal growth development, infant survival, maternity anemia, positive interaction with iron in reducing anemia. So when you have vitamin A, you have iron. It's good interaction to reduce anemia and resistant against infection, because it's responsible for immune function. Reduction of maternal mortality. So the deficiency of vitamin A may increase the risk of illness and death from childhood infection. Because the main thing is here, immune function. If not enough vitamin A when the baby is born, it can cause it increase the risk of illness due to infection, such as measles and those that causing diarrhea. So in our country, in our country, and most of the in all developed country, it's very rare to see kids get die from measles now. Okay, 12 weeks of vitamin A supplements versus placebo and beta carotene versus placebo has been shown to reduce in maternal mortality related to pregnancy. So this has been shown in 1999 by this guy here. 12 weeks of vitamin A supplement reduce maternal mortality. Okay. In Nepal, for example, here another studies, vitamin A supplements of 23,300 IU. IU is the international unit for this vitamin A, retinol, and so on. Every week, 23,300 every week to nearly 45,000 women for 3.5 years period. So in this population of 45,000 women for 3.5 years period with vitamin A supplementation up, at the dose of 23,000, decreased maternal mortality by 40%. Is quite high, right? So before this, in Nepal, the maternal mortality rate is very extremely high. So this study has shown that if you supplement, you give the woman before, before 3.5 years period, before and after, before they get pregnant, decrease the maternal mortality rate by 40%. So for those who are nursing, they are recommended to take vitamin A between 1,200 to 1,300 retinol equivalent unit, RAE. So again here, currently vitamin A is listed on food and supplements label in international unit. To convert microgram RAE and international unit, you can use as followed here, but you don't need to know that specifically. You can just see, when you take vitamin A, your pharmacist will explain, the physician will explain how much that you need to take. Folic acid. Strong evidence that folic prevents recurrent neural tube defects, NTDs. This is one of the main concern when women get pregnant, to have enough folic acids. NTDs is a serious birth defect of the spinal cord, such as spina bifida, and the brain, such as anencephaly, occur when the opening of spinal cord at the back of the body, spinal cord and brain remain from early in human development. So normally when the baby, develop in the mother, before being born, so the baby is still developing, right? So the spinal cord, if this is the woman that carries the baby doesn't have enough doesn't eat enough folic acid, the spinal cord and the brain part will not develop properly. So the occurs when fetus spine and back does not close during development. So you can see, if you Google NTDs, the neural tube defect, you can see that the spine at the back of the baby is not closed properly. So this also reduce, folic acid also reduce miscarriage. Women receiving routine iron and folic acids improve the hematologic indices. So this is extremely important for those who pregnant or planning to get pregnant. A daily supplement of 400 microgram of folic acid during the first 12 week of pregnancy and baby's spine is developing is extremely vital. Okay, in order to to prevent these NTDs, at least first 12 week of folic acid supplement 400 microgram every day. So some women will be advised to take a higher dose of 5 milligram, from 400 microgram to 5 milligram for some individual of folic acid each day until they reach 12 weeks of pregnant if they have a higher risk of having pregnancy effect by NTDs. So for those that maybe have, history of having babies with NTDs, the doctor or physician will prescribe higher dose up to 5 milligram. Normally 400 microgram. So you may have a higher risk if you or your partner have NTDs. You previously had a pregnancy affected by NTDs. You and your partner have family history of NTDs, and you may have higher risk if you have diabetes. These four categories here increase the higher risk of having NTDs. So if for individuals, for those who are planning to get pregnant, you have to consult your doctor before that, or at the early stage of pregnancy, so that the doctor can advise you how much folic acid that you need to take every day. And next, iron. Iron is also important during pregnancy. It's used by the body to carry oxygen via hemoglobin. You know that iron is responsible for hemoglobin, red blood cell. Blood is very important for the babies and for us. Your body makes more blood when you are pregnant because you and your baby are growing, right? So daily oral iron and folic acid supplementation, 30 milligram to 60 milligram of iron and 500 or 400 microgram of folic acid is recommended for pregnant women to prevent maternal anemia, puerperal sepsis, low birth weight, and preterm birth. So by having this iron and enough iron, enough folic acid, you can prevent many things that can cause maternal anemia and sepsis and preterm birth. So low iron level will affect your baby growth and development, as well as increase the risk of premature birth. And then next, next iodine. Iodine essential for healthy brain development. So that's why you need iodine. It's enough iodine. If the mother take enough iodine, it will develop the brain of the baby properly. Okay, because iodine is essential for healthy brain development. A woman iodine requirement is increased substantially during pregnancy to ensure adequate supply to the fetus. The deficiency of iodine, because iodine is necessary for thyroid function, which in turn produce hormone crucial for brain development. Mild iodine deficiency during pregnancy, leading to lower IQ in children. So we don't want this. That's why we need enough iodine. Iodine deficiency also causes mental impairment, or we call it cretinism, condition of a severely stunted physical and mental growth due to untreated inborn deficiency of thyroid hormone. So iodine responsible for thyroid hormone responsible for brain development. It's a lack of iodine cause low IQ in children, fail during brain development, failure, also can cause cretinism, mental impairment, stunted growth, and physical growth. Iodine supplementation may have been largely successful in decreasing iodine deficiency condition. Form of iodine supplementation during pregnancy depends on severity of iodine deficiency. For example, by iodinated food or oral and injectable iodine. These two can be done to fix the iodine level. The US recommended daily allowance is 150 microgram for adults, 175 for pregnant women, 200 microgram for lactating women. So next, calcium. Calcium is I think I'm just all right. Okay, this is all right. 3 more. All right, calcium is a mineral that is necessary for growth and development of fetus. Calcium responsible for bone and teeth. That's why we need calcium for healthy heart, nerve signal, muscle, a steady heartbeat to develop normal heartbeat and rhythm and blood clotting abilities. During pregnancy, calcium in your body supplies your developing fetus. aiding in fetal bone development. To reduce pregnancy-induced hypertension, routine supplementation beneficial for women at high risk of developing pregnancy-induced hypertension or have low dietary calcium intake. So what happened when you have calcium deficiency? This study has been published in the Journal of Therapeutica (JUMCO) in 2007. This study reported that a pregnant woman body provides between 50 to 330 milligram of calcium to the fetus to support skeletal development. So that's a lot, 50 to 330 milligram just for the fetus, for the fetal development, skeletal development of the fetus. The study point out that most women following a Western diet only consume about 800 milligram of calcium, which is short of the recommended amount. So, if the individual only consume 800 milligram, but you need 330 for the fetal, so that's not a lot, that's not enough. So they need for calcium supplement to have at least 1000 milligram daily. So 1000 milligram daily for the pregnancy woman, for pregnant women. Another study in Journal of Nutrition found that calcium supplementation reduced the risk of preeclampsia. So this preeclampsia is a condition in which the woman or the mother experience high blood pressure and protein in the urine and must deliver the baby early. So if you have, if for those individual or woman, pregnant woman who's having deficiency in calcium also can have this high blood pressure and protein in urine. This will cause the preterm baby born. So that is why the calcium is very important during pregnancy. And finally, zinc. Our body needs zinc for the reproduction, repair, and DNA function. So getting enough zinc important for the rapid cell growth and that occur during pregnancy because the fetal is developing. We need zinc for our body, and for women in pregnant, they need zinc for the baby as well. So it is estimated over 80% of pregnant women worldwide have inadequate zinc intake. It's a lot, 80% of women worldwide. So if for those who we don't want to be involved in this 80% because we need zinc for the baby, for us. So low zinc deficiency may lead to poor birth outcomes, low plasma zinc concentration, reduced placental zinc transport, affect the supply zinc to the fetus. If we don't have zinc in our body, we cannot supply enough zinc to the fetus. This alter circulating level of number of hormones associated with the onset of labor. So alter, so because when in women, when they going to have labor, there's a lot, even when pregnant, during pregnant, in the pregnancy time, there's a number of hormone that associated with the pregnancy, associated with the labor. The woman needs to have this level of hormone in correct level. But if you don't have enough zinc, this can alter the level of the important hormone that associated with pregnancy and with the labor. Zinc is essential for normal immune function. Of course, zinc deficient, like vitamin A, immune function as well. Deficiency may contribute to systemic and intrauterine infection and both major cause of preterm birth. And when you don't have enough zinc, also it can cause sepsis during the birth. Low birth weight and premature are significant risks for neonatal and infant mobility and mortality. All right. So this is like another side notes here. You can read by yourself and just hide it because I'm not going to talk about it. It's extra notes for you. Okay, I think we've done with minerals, and I will upload today mineral and vitamin the slides so you can read for your test. All right, before we stop, any question for you? I know that's many of you sleeping, right? It's quite boring. lecturing in this class. Okay, no question?
No, doctor.
No, doktor.
Doktor,
Ya,
nak slide ni boleh?
saya baru je cakap. I'm going to upload after this both mineral and vitamin.
Alright, thank you. Sorry.
Okay. Alright, thank you very much and see you next week. Have a nice day
Thank you,
and
doctor.
stay safe.
Doctor.
Thank you, doktor.
Alright, you're welcome.
Thank you.
You know, the
Thank you, doktor.